introduction. Okay, hello everyone and welcome again to the Medical Science E-Sessions in E-Autumn Assembly 2020. In this session, we'll be talking about health informatics, COVID-19, and how we can proceed with technology while we're dealing with COVID-19. And I'm Berkay Akad Ülker, the Medical Science Director for 2019 and 20. I'll again show you my email in my own presentation. But right now, with the first presentation, we proceed with Daniela Ho.
Okay, so hello everyone again. My name is Daniela Koch and I'm the Medical Science Research and Internal Assistant. And I'm going to start off the session by telling you more about what is health informatics and especially why it is important during the time of COVID-19. Okay, so moving on to the first slide. So this is just a basic definition of health informatics. So health informatics applies informatics concepts, theories, and practices to real-life situations to achieve better health outcomes. So it includes collecting, storing, analyzing, and also presenting data in a digital format. So you can say it's kind of the intersection of information technology and healthcare. And two main goals of health informatics: improve, first of all, the safety, but secondly, also the quality of patient care. All right, so why during COVID-19 now? So you can see there are many different useful tools that especially during this time have become really important. So first of all, it can be used to distribute information more easily, including, for example, requirements for home isolation or appropriate locations to obtain COVID-19 testing. Moreover, it can help track through accessible and secure tools, for example, video conferencing, but also more sophisticated features such as virtual reality. Okay. So moving on to the next slide, you can see a map, and I think it's quite interesting. I guess you've all seen the interactive maps online where you can see how many cases there are in different countries. And this one is kind of similar, but also different because it focuses more on the mental health status and well-being of the citizens. So it's the pan-COVID-19 US Twitter map, which analyzes Twitter tweets to kind of see how people are doing mentally. So for example, on the top left, you can see the change in anxiety from the start of the pandemic, and also how many times different topics like panic buying have been mentioned in general, which symptoms have been mentioned the most in like COVID-19. And also on the right, you have a map of the different states. Again, sorry, it's only for the US, but I think it's still quite cool. And you can click on the different states to see even more detailed information. Okay, so moving on to see how health informatics can be helpful, especially in hospitals and just in the clinical settings. So first of all, they can help with screening. So COVID-19 symptoms from the common flu or colds. And telemedicine has also become really important during this time. Then there are different imaging programs that can help diagnose COVID-19 and also assess the severity of the infection. And lastly, it can help with capacity and resource management. So based on regional infection counts and current patient admissions, it can help estimate how many hospitals are going to be needed, how many medication a hospital needs to order so they can plan better. Right, and moving on to the next slide, talking about bioinformatics, which also I think are really interesting. So for example, scientists have tried to evaluate host genetics of people being affected with COVID-19 and seen kind of their development, who was affected really badly or who wasn't affected as badly, to see, to identify eventually potential risk or protective variants in their genome. And also phylogenetics have played an important role to map the original spread of SARS-CoV-2 based on its rapid mutations with the help of genome sequencing. So for example, one website where you can find a phylogenetic tree of SARS-CoV-2 is the Global Initiative on Sharing All Influenza, or shortly GSAID. I have a screenshot of it on the next slide. The genetic tree on the top left, and you can see the different clades of the virus. So after it mutated, and on the top right, you can also see which clades are most prominent in which countries, which I think it's also quite cool to see from time to time. So in general, we mostly had the orange or yellow clade, and then it developed more, and there were even more different clades. All right. So to conclude this, you can see that health informatics has proven to be a really useful field, especially now during this pandemic. I think there are many different tools, and I hope this was a good overview for everyone. So yeah, so moving on to the next slide where you can see my references. So this is the end of my presentation. I thank you all for listening.
Okay, I'm going to go next. Berke, are you getting the slides or should I take the slides?
You can take it off.
Yeah. All right, can you all see my screen?
Yes, it's working.
Okay, perfect. All right, Danielle just did a great introduction to kind of bioinformatics, about the data aspect of this, and kind of go a little bit more into detail about that. So yeah, this is going to be a little bit about the safety of information and data in that connection. So we have these two images here. One is the doctor, one is data. What is the connection? Where do you see a connection? In fact, the connection that we have here is bioinformatics and health and bioinformatics. So as you see, you know, like you might think clinical data and to do with each other, but it's actually really essential, and it's actually kind of two things that go very much hand in hand if you really go into it. So bioinformatics is actually a field that combines mathematics, information science, so IT, biology, and other aspects as well, in a very interdisciplinary context. And it's actually used for kind of questions of biological nature. So, for example, like Daniela mentioned, we have these examples of genomic analysis and other things in that nature. And then there's something called computational biology, which deals with modeling of biological symptoms. So that's kind of a little bit of something different. But bioinformatics in general has sort of two main goals. The first one would be the development of software tools and algorithms for biological systems. And the second one is the analysis and interpretation of biological data. These two things are something that we've really, you know, seen the use of in this COVID-19 pandemic, to use this to kind of analyze and process this huge amount of data that's being compiled around the world. So clinical bioinformatics is then kind of the direction that this is going to take us when dealing with the pandemic. So it combines computing science with information science, biology, and medicine. And it's kind of, it's obviously a part of IT. It's a part of healthcare science, but it's really it's geared towards care, and it's really patient-centered in this context. Clinical bioinformatics uses tools from IT technology and other similar domains to analyze this data and kind of use it to make biological systems and models. So the three main areas of bioinformatics that I'm going to go into a little bit are genomics, health informatics, and physical sciences. So what's really relevant in this COVID context here is obviously health informatics, which we just were introduced to earlier. Okay, in this context, I'm going to talk about the concept of big data. What is big data? This is the definition that the Cambridge University Dictionary gives us. It's very large data sets of data that are produced by people using the internet, and that can only be stored, understood, and used with the help of special tools and methods. So the essential thing about this is really that it's about large amounts of data that are generated at the same time, so that need to be collected simultaneously, that occur in a real-time scenario. So it's really something that needs to be processed with large information processing devices and technologies. So obviously for big data analysis, we're going to have to use big kind of analysis testing devices. And I'm really sorry to pause, but I'm going to shut my WhatsApp off for a second. I'm so sorry. Okay. Okay. So as I was just saying, we're going to really need big technology that can process this data and this amount of data sets. So big data analysis includes structured, semi-structured, and unstructured data that it comes from different sources. As I said, it comes at high volume, at high velocity, at high variety. So, you know, it's in the name. It's big data. It's big data sets that need to be analyzed using different kinds of technologies. And these can be analyzed with also newer technologies such as artificial intelligence, mobile technology, and also other things that are in development currently. And big data analytics is something that's used not only in sort of like research, but also in business, so for some kind of business analysis, and also for health informatics. Okay, so to kind of bring this into context, there is a United Nations Global Working Group on Big Data that focuses on concept of big data for current, you know, world issues. I have a little quote here from their like proclamation. The UNSC recognizes that in our digital age, a wealth of digital information and big data sources exist and could be utilized by NSOs, governments, companies, and individuals. So taking this into account, this working group focuses on 7 different like main tasks here. So we have management of big data, access and partnerships, the sustainable development goals, training and capacity building, satellite imagery, communication data, and social media data. This is all a lot, but pretty much this is just to show you that big data is something that is not, you know, health specific or anything. It's really a concept that is just new to our digital age, and that is that's really important when different systems in IT and in the IT domain. So this UN Global Working Group had a conference at the end of August, at the beginning of September, and it was largely focused on the COVID pandemic. And what they kind of talked about here was that for the COVID pandemics, things that are really important are obviously government interventions in context with data collection, so testing and tracing, you know, every other intervention, but all of these interventions, you know, all of these restrictions, all of these bans need to be somehow evaluated and analyzed. So they say that these require specific, reliable, and timely data, especially on mobility and physical co-presence. And this is obviously something that requires data collection, and that is something to do with contact tracing, which I'm going to be talking about in a moment. And then lastly, they concluded and said that the statistical community also would be useful to kind of assess social economical damages and consequences of this pandemic. So here's just a little sentence of something that was kind of concluded from this meeting. At the same time that the statistical community develops methods for measuring human mobility, it also wants to maintain public trust in the use of statistics and indicators. Statisticians need to explicitly discuss how it guarantees privacy, data security, and only use data for statistical purposes. So as you can see, even though this is kind of like a data conference, obviously, something that they are largely concerned with is privacy as well, because it kind of almost goes hand in hand nowadays. We have data collection on the one hand, and on the other hand, we have people saying, you know, there need to be boundaries, there need to be ethical boundaries, there need to be political boundaries to ensure that this doesn't go too far. So let's look at this in the context of contact tracing, for example. So what is contact tracing? Contact tracing is, obviously, I'm sure you're all familiar with the term, but it really is about finding the people who have been infected with COVID, for example, in this scenario, and using this to break the chain of transmission of infectious disease. Contact tracing is actually defined by the WHO as an essential public health tool for controlling infectious disease outbreaks. So as you can see, it's really something that is absolutely necessary for us to use pandemic as we have right now. And in the context of sort of data analysis, data processing, it's really important to be using the correct indicators, the correct monitoring indicators to collect this database. And obviously ensure that, the data is not only collected correctly, but that it's stored correctly as well. Then going on to transmission chains, chains, sorry, is something that we use in bioinformatics to kind of, obviously, we want to analyze transmission chains in order to do contact tracing correctly and use this to compile large sets of data. But the issue is that this really needs, as I just said, large amounts of data in real time, and this is something that needs to be done meticulously and actually done very thoroughly in order to get adequate data. I just want to say quickly that transmission chains are obviously something that you can look at the individual level. You can say like, okay, how do I transmit something to my neighbor, like I cough or something. But the bioinformatics perspective in this case really looks at large scale, person-to-person chains. Where did this person go? Where did that person go? So it really depends on mobility and like mobility data and transmission in that context. So I have one last quote here by Kelly Henning, who's an epidemiologist. And she said about transmission chains that contact tracing is one of the few available strategies we have to stop the chains of coronavirus transmission and ultimately reducing the number of cases and deaths. So as you can been recognized by organizations, by epidemiologists, as something that's really, really essential and something that we actually really have to, do thoroughly in order to have the pandemic somewhat under control, or at least know where it's going. So in this context, I just want to conclude on a short moment of data protection. So as I just mentioned, it's something that is a topic. As soon as you get data, you need to make sure that it's safe and that you're actually protecting people's rights while you're doing so. So the one thing that's just really essential about this is to consider the ethics and to consider the legal frameworks. One thing is also that you need to be transparent about how you're handling the data. You need to make sure that data is stored in a safe place and that people who wish to have their data erased have the right to have their data erased if it's not anonymized. So this is something that is a topic that is getting more and more relevant as organizations, society collect more data from us. And it's really important to kind of assess and evaluate the digital tools that we're using in this context in order to ensure data protection and ensure data safety and security. So with that, I want to thank you for your attention. This is the end of my presentation. I would be happy to take questions if anybody has questions, but I think we might just do that at the end. But you can always just type them into the chat box for now, or obviously email me anytime. So thank you. I'm going to stop sharing right now.
Okay, hello. Do you see my screen and hear me well? Okay, I'm gonna take this as a yes.
Yes.
Hi everyone, I am Suda Chowdarolu, Medical Science PR and External Assistant. Today I'm going to be talking about the assessment of possible COVID positive patients via softwares and apps. My outline is going to be like, first we're going to talk about the geographic risk assessment examples. And then we're going to talk about the importance of standardization. And then we're going to talk about the medical record sharing and its collection. First, let's talk about the geographic risk assessment examples. Here, I know that we have a lot of phone lines for, confirming. And but specifically, I'm going to be talking about the applications today, which helps with the contact tracing. So here we have engineering software that was done at Johns Hopkins University. And I think almost everyone knows about this. And this is like the data comes from the WHO specifically, which is updating like almost every minute. So here's one. And the other one is the geographic risk assessment. This is an article that I found, and they are explaining that they have created an algorithm that they use case fatality rates to describe risk to understand the transmission of the coronavirus. And then the app was developed to display the countries that has higher travel risk and lower to understand the transmission. And this is an example from South Korea. I think it was like one of the first examples that I've ever heard. This was obligatory, that everyone almost had to download the app and check their status, if they were red or green. And this was done by South Korea's Center for Disease Control and Prevention Center. And app called 100 meters. So this was the app that was related. But what I found really interesting is that the country is also going to start strapping electronic wristbands for people who are ignoring the quarantine orders, and they are going to be moved to a shelter if they refuse to stay at the quarantine. And also there's another one called Healthy Linked. And what I found interesting about this one is that it has an option called Health Positive, which means that you can actually report yourself as positive or negative. And I actually downloaded the app to see how many people has done that. And worldwide, there were, by yesterday at least, there were 610 themselves. I think this is an important one because it also alerts the contacts near them or if they were in touch with them. So this is a Turkish app which is called Life at Home, and it was actually developed by the Ministry of Health of Turkey to inform the citizens about the rate and the location of the virus and how many people were positive around the location, to basically kind of prevent an outbreak. And also an example from India, a smartphone app that I can't pronounce, downloaded 75 million times, and it gave me a really hope, considering that the Indians' population is around 1.3 billion, and it was in a really short period of time. And what I liked about it is that it was available in 11 languages, and it actually uses Bluetooth technology to check whether there's a corona case in their vicinity. Now let's go on to the importance of standardization. Stella has actually talked a bit about it, and we're gonna be having a discussion. I'm gonna kind of just mention the subtopics. The importance of data sharing, that it should be time limited, and the minimization of the data is really important. and proportionality is important. And some people say that people should be volunteered but not obligated to. And also the transparency and explainability of the data that we provided is really important. And probably the most important one is the security, since people not only medically, but with this corona applications, we see their GPS locations and everything. So that's also an issue, and we're going to be talking about that during our discussions as well. So now on to the medical record sharing and collection. Okay. I'm going to give an example of China, because China uses a QR code, which is, I believe, very initiative. And you have to scan these codes before entering a bus stop or a train or even your home. And this is not about your current, not only about your current status as well. So I kind of looked at the details, but I couldn't find so much about it. And this is where it comes to the question of the security and the data minimalization. And obviously it has three colors. Green is you're good to go, and yellow is that is a quarantine, and red indicates that you require 14 days of quarantine. And this is a Turkish program, and it is also the application of a Turkish Ministry of Health. So this is a really good one, as in the data collection, because you actually can see all your health history from the diseases for the radiological images, and all the prescriptions you had, and which hospital you have been. And right now they actually added another part, which is about a COVID-19 situation, which you can see your results if it's positive or negative, and you can report yourself as at risk or not. And when I'm talking about its security, here comes the part that I love. This is like a screenshot chart of the application, and you can actually adjust your sharing settings if you want to see only your family and physicians to see your information, or all the physicians to see your information, which I believe almost every application should have. So these are my references. Thank you all for listening to me, and I'm open to questions as always. Thank you.
All right, continue. Okay. I have to do it like this because my computer freezes when I do it full screen, so I'm sorry about that. Anyways, hi everyone, thank you for being here. My name is Lara. I'm the Health Policy Capacity Building Assistant for this term, and I'm happy to be a part of the team. And I'm going to talk about telehealth intervention at the time of COVID-19 with a special focus on chronic / routine care and mental health. So Daniela gave us an excellent introduction, but I will just quickly mention the journey of telehealth, aka the definition. On the screen, you can see a definition provided by Mayo Clinic, but I would like to read you one from the World Health Organization, because it just kind of covers all grounds. Telehealth is the delivery of healthcare services where patients and providers are separated by distance. It It is used for the exchange of information, for the diagnosis and treatment of diseases and injuries, research and evaluation, and for the continuing education of health professionals. Telehealth can contribute to achieving universal health coverage by improving access for patients to quality, cost-effective health services wherever they may be. It is particularly valuable for those in remote areas, vulnerable groups, and aging populations. So, as you can see, this definition is extremely broad and actually covers the aims of current telehealth initiatives, which is what I would like to talk about next. But there are some barriers in the way of the implementation of telehealth, and these are namely a lack of funding to develop and support telehealth programs, a lack of infrastructure, equipment, and connectivity, competing health system priorities, and a lack of legislation or regulations. But we are bound to see a change for the better in this after and during this pandemic, because if anything, this pandemic has shown us how desperately we need them. And plus, the World Health Organization and the World Bank report that half of the world's population does not have access to essential healthcare services because they are inaccessible, unavailable, not affordable, poor quality. And we see potential of telehealth really shine in this aspect. All right, so as you can see, we have many aims beyond these as well. Things that I would like to focus on, especially in a time of social isolation. The first is accessibility, and I kind of went over that with the definition, but funds and efforts devoted to telehealth can improve access to routine healthcare procedures for vulnerable populations, as well as for patients with reduced mobility, whatever the reason might be for that. And patient-physicians connections can extend beyond borders with such initiatives. And it can be the source of patient data for physicians as well as the patients themselves to keep their records and not be afraid to reach out to other doctors. The second is improving communication. Again, at a time of social isolation, we have an immense need for different methods of communication without necessarily going to a hospital to see a healthcare provider. So there have been numerous initiatives to increase and allow patients to schedule appointments or request appointment reminders with ease. Self-management of healthcare. Telehealth can obviously be used to extend the scope of a patient's understanding of their condition and what they need to live or treat their condition. And it can kind of reduce their dependence on a physical environment for healthcare. Virtual appointments, this kind of includes all of the above, but I know that there were some initiatives by NHS, which is in the UK, for virtual appointments with a GP, which allows patients to see a doctor for some conditions, which are, I'm guessing, not too acute, without leaving the hygiene, safety, and comfort of their own homes. And such tools have also been used for patients in the ICU, where doctors have monitored the condition of these patients without actually getting in their room because there have been extreme shortages of personal protective equipment, especially at the start of the pandemic. So we can see the benefits of these initiatives, but obviously, like with anything, there are some drawbacks, which is some conditions are, they can only be recognized if there is in-person evaluation, and it is hard to replace this. But it is obviously the case that these healthcare technologies can improve access drastically beyond borders, like I said. And remote monitoring, this is very largely applicable to anything. These remote monitoring technologies include, smartwatches, websites or apps that you can record your blood glucose or blood pressure levels, wearable devices, home monitoring devices for older people with dementia. It can detect changes and normal activities. Okay. And like I said, I would like to give some examples of this because people are working really hard and funds are being allocated to these technologies to be improved. Examples of and evidence to support the effectiveness of telemedicine are fairly diverse, especially in the context of depression, anxiety, and PTSD, because people are so different and methods of care. One huge initiative is Big Health. So this is, I believe, a UK-based organization, and it focuses on sleep improvements and anxiety. Excuse me. And they have, I think, 2 products which are very interesting in my opinion, which is called Sleepio. And they are still in the process of collecting data for this, but I think they have done some amazing progress and it's being shared as well. Because social isolation has, affected our lives in many ways, and it may be hard to recognize why we're feeling sad and down. I think at this time, a lot of us are, finding ourselves beaten down, and sometimes there's no reason, but obviously there's a huge reason for that. And that's why these telemental health initiatives have a huge role in distance care of such people. And we have the World Telehealth Initiative, which provides medical expertise to world's most vulnerable communities to build local capacity and deliver core health services. And it is consisted of a network of volunteer healthcare professionals. And we have NeuroDirect for stroke diagnosis. I have seen so many news around patients being afraid to go to the hospital because they want to avoid, the craziness and the lack of hygiene there. They don't want to leave the comfort of their own homes, but that also means that some conditions can go unnoticed and they can be potentially, one of which is stroke. So NeuroDirect aims to, tackle this issue. With this initiative, the neurologist can examine the patient interactively via webcam. They can review the patient's CT scan as well as blood work, determine if the patient is eligible for TPA or, possibly endovascular treatment. This is especially important for places in which 24-hour neurology care is not available. And this is a huge issue because in places where they don't have access to a fully equipped hospital. And the COVID-19 context, to conclude my presentation, I won't go into too much detail because my session team has done an excellent job about this. But telemental health services have been prioritized during this time, especially for frontline workers, because they are dealing with an immense responsibility during this time, and they're putting themselves at risk every single day. sometimes without proper protection. However, in general, for telehealth to be effective, during this time and in the post-COVID era, we need standardized procedures and their effective integration into our health systems. And we need, like in the WHO definition, we need continuous education for healthcare professionals and medical students, telehealth networks, policy to be scaled up and funded in preparation for such times of disaster. All right, here are my references, and obviously this is too little time to go into detail about any of this. I would wholeheartedly recommend that you look into any of these sources I have provided here because they were really amazing. Yes, that is the end of my presentation. Thank you for your attention.
So let's move to the last part of this session, the last presentation actually, before we have a discussion. Okay, so can everybody see my presentation? You have the attendance form again, but that's really useless for this presentation. And let's just move on to the main part of this session. Okay, so actually we talked about so much things about the artificial intelligence, the Internet of Things, the machine learning, some solutions of software for COVID-19. And actually we had a glance of what technological advances in medical science right now regarding COVID-19, but also in general healthcare. So to sum everything up, I want to have something about the solutions of AI to COVID-19 management. Again, to make you remember, my name is Berkay and I'm the EMSA Medical Science Director for this term. And anytime you want to reach me, you can reach me from this mail. But just wait for a minute so that I can use my pointer before we start. Yep, so here's my mail. Anytime you want to reach me, you can reach me. And actually, there are some of you reaching me anytime you want to. So the source of content of this presentation is actually only one article because it's kind of interesting that only one article supports the COVID-19 solutions with the artificial intelligence, and actually that's a problem. And then in the discussion part, we should be talking about this. Why are we afraid of using artificial intelligence that much? And actually, why companies use artificial intelligence too much, but healthcare workers are afraid of using it? And again, before we go here, you can just read this article anytime you want. It's a highly suggested article that I want you to read after this session. And let's continue. So, the healthcare delivery needs in 2020. We can say that actually we have requiring the support of new technologies like artificial intelligence, AI, the Internet of Things, IoT, big data, and machine learning. So to fight with COVID-19 and look ahead against the new diseases, we have to be working with these. But most importantly, we have two things here that are really important: artificial intelligence and machine learning. And we'll be diving deep into those. So, as the world fights with COVID-19, actually every kind of technological innovation is important. And also this pandemic brings us one step closer to inventing new kinds of technologies to deal with it. And actually we are right now not living in the Spanish flu times 100 years ago. We are right now living in the 2000s, which we have most of the technology and which we can have actually hackathons to find new and more usable solutions in technology. So, healthcare organizations are in an urgent need for decision-making technologies for them, and actually because of the excess amount of patients inside the clinics right now, we need the artificial intelligence to make our jobs easier. So to handle this virus and help the healthcare workers getting proper suggestions in real time to avoid its spread, we are using the artificial intelligence, and there are some examples that we talked about. So AI actually works in a proficient way to mimic like human intelligence. So the point is it mimics and copies the human intelligence, and it makes us to prepare something in computer that feels and actually that thinks like the human intelligence. So we can say the AI may play a vital role in understanding and suggesting the development of a vaccine for COVID-19. This result-driven technology is used for proper screening, analyzing, prediction, and tracking of current patients and likely future patients. So actually you can test your drugs with the artificial intelligence and with neural networks. Secondly, AI has the potential to improve the planning, treatment, and reported outcomes of COVID-19 patients, being an evidence-based medical tool. So this means that we will be having a figure after the next slide, and you will see how AI can help the medical professionals to deal with the COVID-19. So there you go. So I don't know if you can see this part, but I hope that you can see. It says patient with symptoms. So in the conventional approach, and let's just talk about what is a conventional approach. Some of the maybe third and fourth year students might know about the term already. The conventional approach is actually the traditional approach that we have inside the clinics. For example, if we talk about the computer tomography, CTs, we have the conventional CT, which is the usual CT that we use as the medical professionals. But again, there is a CT with the artificial intelligence, and it is an AI-based approach. That's only an example. The AI-based approach creates the bowels with the images on the computer by using the CT, and it's actually much more easier to have the colonoscopy to see the insides. But again, it has all its own disadvantages, but that's another issue. The problem is just I want to explain you what conventional is. It is the traditional approach. So in the conventional approach with the non-AI approach to the COVID-19, first the physician analyzes the symptoms, and basically if no multiple matches found, no test sample taken. That's easy. And then comes the if multiple matches found, then the test sample is taken. And then the patients get quarantined, admitted to the healthcare. And after that, the symptomatic treatment starts. And then the recovery phase starts. And then we retest for COVID-19. And if it's negative, we say the patient is cured. And if it's positive, again, we continue the isolation. So as you can see here, actually, this is really complicated. And in this part with physicians, we have the risk of having so much failures here because the doctors and physicians might actually get it wrong because you're dealing with so much patients, and sometimes you might get confused, which is really, really natural. So with the AI-based approach, actually, the physicians identify the possible match of COVID-19 symptom with AI support, and then the samples taken to confirm infection and decide further therapy. The patient gets quarantined, admitted as usual, and then at the second part, again, we use the AI. For every patient specifically, we use a start AI-based treatment and monitoring. And after that comes the recovery phase. And again, the same, retest for COVID-19. If it's negative, it means it's cured. And if it's positive, it means it's isolated. And then we need to isolate them. So as a summary here, what we have to know is actually AI can help us with the things that we should memorize. But if we let AI memorize things and remember things, then we have the freedom and ability to actually have some decision making ourselves. And actually, we have the freedom of commenting on the patients. So that's really important for a doctor. And that's actually the skill that we should learn in this age. So let's talk about the main applications of artificial intelligence in COVID-19 pandemic. And this will be the funny part. So early detection and diagnosis of the infection. AI can quickly analyze irregular symptoms and other red flags regarding the COVID-19. So actually, it helps to develop a new diagnosis system and the management system through some useful algorithms that you uploaded. And then the AI is helpful in the diagnosis of the infected cases, and also with the help of medical imaging technologies, such as, for example, I think already you know about this stuff. For example, the computer tomography and magnetic resonance imaging that we use in the COVID-19 can be actually applied to the artificial intelligence, and it can detect if somebody has the symptoms of COVID-19. Again, there comes the monitoring the treatment. Actually, a neural network can be developed to extract the visual features of this disease and to create patient-specific treatments. And after that, this would actually help in proper monitoring and treatment for the healthcare professionals. And also, there is the capability to watch and monitor every patient day to day and see the improvement of them in the prognosis. And again, as we told, the contact tracing of the individuals can be made with the artificial intelligence. AI can help analyze the level of infection by this virus, identifying the clusters and hotspots during the maps and also during the places that they live in. So that's actually important. And again, it can predict the future course of this disease and likely maybe other new diseases and maybe the reappearance of COVID-19 in the future. The projection of cases and mortality. Again, we talked about this. The AI can predict the number of positive cases and death in any region. And also that can help identify the most vulnerable regions, and we can therefore help them as soon as possible. The development of drugs and vaccines, as I told you, the AI is used for drug research by analyzing the available data on COVID-19, and therefore it can create some virtual patients and you can test your drugs virtually and you can see if they work or not. So the technology is used in speeding up the drug testing in real time, and also which may not possible by a human to accelerate the drug testing, because in the human tests, it's actually much more slower. The AI helps in developing vaccines and treatments at a much faster rate than usual, and it's also helpful for clinical trials when you're trying to improve something. And reducing the workload of healthcare workers. Again, actually, I talked about this in the very beginning of the presentation. We should be reducing the workload of healthcare workers because therefore we should reduce the risk of their having mistakes. And actually, it will be us in the future that will be making the mistakes, and we need this help. So, due to a sudden and massive increase in the numbers of patients during COVID-19 pandemic, actually, healthcare professionals had this high workload anywhere in the world. Right now, healthcare workers are working extremely hard. So, with the AI, we can actually help the early diagnosis and also the treatment, and also the best training to the students and doctors regarding the new disease and also the other new diseases in the future. And it seems like that we'll be having them. And also prevention of the disease. Lastly, the AI is helpful for the future virus and disease prevention, as I've been telling you. With the help of previously mentored data over data prevalent at different times, actually, we can predict the future pandemics. Therefore, AI will play a vital role in providing more predictive and preventive healthcare for us. And I hope that with the AI, we should be solving much faster the future pandemics and also especially the COVID-19 that we've been dealing at the moment. So, to finish the presentation, I have some take-home messages. Actually, these are the highlights of the article that I shared with you at the beginning of the session, and actually I just copied them, didn't change anything, and I think the highlights of that article are really, really important. So, the artificial intelligence is an innovative technology which is helpful to fight the COVID-19 pandemic. Secondly, this technology is helpful for proper screening, tracking, and predicting the current and future patients. Thirdly, the major applications of this AI are for early detection and diagnosis of the infection. And lastly, AI is used for the development of drugs and vaccines and reduction of workload of healthcare workers. So, finishing with my presentation, actually, that's all that we're going to be telling you about the artificial intelligence. And right now, let's continue with the breakout rooms and our discussions for 15 more minutes, and then we'll wrap up and finish the session.